The total shoulder replacement for shoulder arthritis. In a healthy shoulder, there's a ball and socket joint. Both sides of this joint are covered with a layer of cartilage, which allows for smooth and unrestricted motion. The ball, also known as the humeral head, is found on top of the arm bone, known as the humerus. The socket, also known as the glenoid, is part of the shoulder bone, also known as the scapula. In a shoulder with arthritis, the cartilage on both the ball and the socket are worn, thin, or completely absent. Without cartilage, there is bone-on-bone grinding when the shoulder is moved. There are often bone spurs seen in the bottom part of the ball, as well as behind it, in front of it, and sometimes even on top of it. These bone spurs often restrict motion of the shoulder. When treating shoulder arthritis surgically, we often start with the arm bone. We make a cut at the base of the ball, and then we remove any offending bone spurs which may restrict motion. This initial preparation of the arm bone allows us access to the socket. Here we can remount the socket so that it has a proper concavity. We then use a special jig to machine out the socket. This allows us to insert a new artificial socket. This component is reasonably durable and covers and protects the reamed out socket. After insertion of the artificial socket, we prepare the arm bone for the main shoulder implant. A humeral component is pressed into the humeral canal. The top of this implant is properly sized to replicate the ball surface the patient once had. It is made from a special stainless steel which is extremely smooth and polished and sized to match the artificial socket. The stem of the humeral component is made from a special titanium which bone loves to grab onto. The previous bone-on-bone shoulder joint has been replaced with a polished metal ball on a plastic socket. This should allow for much smoother motion with less restrictions and greater comfort. And that's a total shoulder replacement.